All right, everybody, we are going live to YouTube. So consider posterity for anything you might say.
So Supervisor Schofield, we're not seeing your video. I don't know if you have it turned off on purpose or if you're getting it figured out.
No, it tells me that Caleb has it turned off.
Oh, we went through this last time.
This thing.
Oh, let's remember how
Oh
did you figure it
my.
out? It was under a. Okay. All right, this is really the great test. Do we remember?
Right. Well, I'm glad that came up a few minutes ago. So now I can try to figure it out.
Well, I need a haircut anyway, so.
Is it under participants? No. No. Chat. My video says the host has stopped it. Okay. So we went through this before. Let's figure this out. God, I wish I had written it down somewhere. I'm counting on you, Molly. I don't remember.
Yeah, and really, I believe it was Ryan who really figured this out last time. So I'm looking. Stop my video.
Hey, it's okay. Really. Oh, there's Ryan.
Oh, good. Ryan's the one that knows how to do this. Ryan, we're having the turn the video on challenge again.
Am I the one? I always Google it, but I can't. Let me see. There's supposed to be like a button in the participant list that, right, or something like that.
Oh, I think I figured it out. Okay, try now, panelists.
What did you do? We got to remember this. Tell me your secret.
Hey.
Panelists, side panel at the bottom, the 3 ellipses. And then it's a setting in there.
It's so funny. I don't have that.
So we're still
Okay.
waiting for Supervisor Miller. Is he joining us?
He didn't say he wasn't, but why don't we start with Supervisor Schofield? Let me start the recording. One moment. All right. Good afternoon and welcome to the Nevada County COVID-19 Business Task Force meeting. This meeting is being recorded and broadcast live on YouTube. My name is Caleb Dardick, and I'm project administrator in the CEO's office. Welcome. I know there's about 77 of you who are signed up, and it looks like 23 of you so far. All of our presenters are here. So let me turn it over to Supervisor Schofield for a welcome.
Thank you, Caleb. Well, so welcome everybody. I don't really have any motivational speech to start with, but I do feel really good. It feels like we can see the light at the end of the tunnel here. There's so much that's going on at the county level. So I think it's just important to get ourselves right into this seminar and get to talking to people like Ryan and Molly and really kind of give us an update on the vaccine situation as we are. So again, welcome. And Caleb, I'll turn it back to you.
Yeah, thank you, Supervisor. I do think there's an optimism out there, and we know it's a big lift to vaccinate the entire world during a global pandemic. But the guy who's shepherding us through it all locally is Ryan Groover. So Ryan, can you give us the vaccine update for Nevada County?
Well, I appreciate the chant, and I certainly don't deserve the credit. We've got a public health team that's really doing heroic work, and one of the key things that they're still doing, even though so much focus has shifted to vaccine, is contact tracing and investigating and containing actual COVID cases. So as of yesterday's update, we are at 3,540 cases in Nevada County. 2,498 of those are in Western County, 1,042 are in Eastern County. In terms of trends, I think we've started to see some positive movement, although our tier data, the metrics by which the state puts us into either the purple, red, orange, or yellow tier, which dictates business openness or closedness, if that's a word. Our tier data got a slightly worse on Tuesday, but keep in mind that there's a 7-day lag associated with that, and the daily case count does appear to be trending in the right direction. In fact, yesterday, I believe we added 14 or 11 cases, which is the lowest, I think, since mid-November. And you can't read too much into a single day's new cases, but that's certainly a lot better to say than the highest since mid-November. And it does appear that we're starting to see a somewhat of a decrease. That said, we still have 586 active cases, so that's a lot, and it means that public health has to prioritize who they're contacting, and they try to focus on people who are in older groups or in more vulnerable categories in that outreach. Our hospitalizations have also dropped significantly since they saw their peak in sort of a December timeframe, and so we're on the right track as well in that area, and that's recognized regionally and statewide as the Greater Sacramento region came out of the regional stay-at-home order a couple weeks ago now, and then the whole state came out of the regional stay-at-home order recently as well. So that's the COVID situation. I would also, and then the next thing I'd like to talk a little bit about is vaccines. I don't know if we need to pause for questions or anything like that, or should just keep trucking along. If anybody has questions about the COVID situation, I can answer them before doing a PowerPoint on the vaccines.
Yeah, just let me remind our attendees that you can submit questions through the Q&A box, and a number of staff are able to answer those in real time or bring them back to the panel. And of course, we can have chat, which is off to the right of your screen. So seeing none, why don't we continue, Ryan?
Sure. So I'm going to screen share, and for anybody who already saw the UBNet town hall, this will be somewhat of a repeat, although I have updated the data that's in this PowerPoint presentation. So definitely wanted to start getting the message out about the kind of broader framework for vaccines, how things flow, so that we can start answering the main questions people have, the sort of when, where, and how will I get my vaccine. And some of those questions we can answer for some people and some we can't, and I'll try to explain why that is. So first of all, a little bit about the vaccine. So currently there are two vaccines approved for use in the United States, Pfizer and Moderna. They are both 2-dose vaccines, mRNA vaccines, which I am not a physician, so I won't try to explain exactly what that means. But they're both 2-dose vaccines. And so when you get that first dose, you then have to wait 21 days with Pfizer or 28 days with the Moderna vaccine, and then get your second dose before you receive the full effectiveness of that vaccine. In the works are 1-dose vaccines such as Johnson & Johnson, who shared some preliminary information on the effectiveness of their vaccine, I believe, on Friday. And it was shown to be around 62% effective worldwide. It's more effective in some places than others. It was less effective in on the quote unquote South African variant. But I did reach out to our health officers and say, hey, this doesn't seem that great when you compare it to Moderna and Pfizer, where you see 94 to 95% effectiveness. And they indicated that actually for a 1-dose vaccine, in the 60% effectiveness is actually pretty effective and can achieve community immunity if enough people are vaccinated with it. Additionally, the vaccines, even though they're not 100% effective at preventing infection, they're close to 100% effective at preventing severe infection and hospitalizations. And so that's key, because not only do they provide a lot of protection from getting sick, but they make it so that we don't have the severe impacts that have really necessitated a lot of the horrible things that have happened over the last year. In terms of safety and effectiveness, I've already talked a little bit about the effectiveness. I will just reiterate that the safety is reviewed at the federal and state levels. So the state established a multi-jurisdictional independent review panel that's looked at the safety and effectiveness. We have a lot more information linked from our websites if you want to get the ingredients and things like that. You can go out and do that. And then just lastly, the cost of the vaccine. The vaccine is free to the end user. Providers may charge an administrative fee, but that's not billed to the person receiving the vaccine. It either goes to the health insurance company or Health and Human Services at the state or federal level. Do also want to indicate that it's necessary to continue to be vigilant even as the vaccines start rolling out. We can't let our guard down just because there's a quote unquote light at the end of the tunnel, because it'll take time before we have enough vaccine to achieve protection from people being vaccinated. There are also variants circulating that appear to be more transmissible, and in some cases, the vaccine is less effective against them. And also, it's not yet clear that being vaccinated necessarily prevents you from spreading the virus to others. So even if you get vaccinated, we're asking people to continue to wear masks, social distance, and all those other things. So high level, how the vaccine gets into our community. I think this is important for people to understand. So we have, it all starts at the federal level with the Health and Human Services Agency, where they procure and distribute vaccines in 3 channels. So they procure the vaccine. They then distribute it out through this pharmacy partnership, which is nearing its end, at least phase 1 of it, where they've partnered directly with certain pharmacies in California, that's CVS and Walgreens, to administer vaccine in long-term care facilities, skilled nursing facilities, elder care, memory care. And that comes into our community directly through that federal channel. And then Indian Health Services, who receives vaccine as though they're a state, and they've been vaccinating their healthcare workers and their patients. And then the federal government also allocates to states. So they split up the remaining amount after those previous 2 and allocate them proportionally between the states. The state then uses 2 main channels to get them into the community. So one is through what are known as multi-county entities. These are health providers like Dignity Health or like Sutter or like Kaiser Permanente that operate in multiple counties and provide a lot of primary health care as well as hospital services. And so they get direct allocations from the state. They don't come through the county channel. They're also not accountable to the county in terms of how they use that. And they've been vaccinating healthcare workers and increasingly patients as well. And then finally, public health. So the rest of the vaccines after those 3 other channels goes through what's called the public health channel. And predominantly what public health does with it is distribute it out to the healthcare system that already exists, the pharmacies, the clinics, the primary care physicians to be delivered. And they vaccinated in phase 1A their healthcare workers and have started in on their patients as well as other people in phase 1B. And then public health does directly administer vaccines as well. And I'll talk a little bit more about that in the next slide. But a couple things to call out. First of all, we pull down every dose of vaccine that is available to us. When we've kind of pointed out that there's a situation of scarcity, and that's why we can't vaccinate everybody who's eligible right now, we've heard feedback, well, why didn't you order more vaccine? We're ordering every dose that's available to us. And then another thing, and this is a key difference that's creating a lot of frustration, is that multi-county entities provide primary health care at different levels in different communities. So Dignity Health is doing a great job. They provide primary health care to about 3,500 Nevada County residents who are 65 and older. But they don't have, not as high a percentage of our community gets their healthcare through these multi-county entities as you see in some other places. And so, as I described before, when you have a Sutter who has primary healthcare all over the Sacramento Valley and Kaiser all over Placer, when they're receiving vaccine, they've started to be able to reach out and provide that to their patients who are 65 and older, which Dignity is doing as well starting February 5th. But that's something people are seeing, okay, I have friends who got their vaccine at UC Davis or at Sutter. And so that's a thing that's very different between counties and hopefully is going to be stabilizing a little bit because and some new information, the state is starting to account for our 65 plus demographic and allocations. And so Nevada County should start getting more and more, which hopefully should equalize for some of the, in my view, inequity that's been caused by the variance in kind of healthcare infrastructure in communities. So how vaccines normally flow, just using flu vaccine as the primary example. Every year in Nevada County, between 40,000 and 45,000 people are vaccinated for the flu. only around 1,100 to 1,200 people received that vaccine directly from public health, predominantly in the big clinics that they pop up each year. The rest of it, the vast majority, goes through the healthcare system that already exists. And so that public health's role is both to directly administer to vulnerable populations and people who can't access healthcare through other services or other means, but predominantly to coordinate with other local healthcare providers and onboard more to receive that vaccine. And so we're actively doing that, and we have a growing list. As of last week, it was 10. I think we're closer to 14 or 15 right now. And so what we do is we pull down vaccine directly for us to administer, and then we also, we've onboarded a new healthcare provider. We pull down vaccine for them. They can vaccinate their healthcare workers and start to vaccinate their patients, and that is ongoing. I do want to call out a potential change that the state has started to message, and that's a third-party administrator. So I just described the current structure. What the state's talking about is taking out that role, and public health would continue to focus on vulnerable populations, but they would bring in a third-party administrator who would then focus on high-volume providers, incentivize them to turn around vaccine quickly, and really take on that coordination role. So the governor mentioned today that, or was asked by the media and identified today that those third-party administrators will be Blue Shield and Kaiser Permanente. We still don't have a lot of details about exactly what that will look like. I think the devil's in the details as to whether that's a good thing for us. It very well could be if they're incentivizing providers and paying them to administer the vaccine and they're focusing on high volume throughput, then that could be a very good thing. It also could be disruptive given that we've onboarded so many providers. And so we're carefully watching for how that plays out, and we should have more details in the coming weeks. So in terms of stats, where we are as of the last report, so as of last Friday, we had received a total of 8,850 doses. I have an extra zero here, that's wishful thinking. We distributed 5,900 of them to our partners, and 2,950 of those doses were delivered to Nevada County Public Health for direct administration. Doses to be delivered this week are 1,775, bringing the total after this week is concluded at 10,625. That includes both first and second doses. So keep in mind, with 2-dose vaccines, you have to vaccinate everybody twice. And so we're getting these allocations, we're pulling them down as quickly as we get them and using them and getting them out there to our providers to use. Then through the other channels, this is as of midweek last week, Dignity Health had administered approximately 1,400 vaccines in the community, and Chop a Day had it between Auburn and Grass Valley around 800. And we still don't know how many the pharmacy partnership has done because we don't have access to that data. So a little bit about when will vaccine arrive. So we always knew that it would take time for the vaccine production to ramp up and we would be in a situation of scarcity at first. And so it is starting to ramp up. As I mentioned, the state's starting to account for the proportion of the community that's 65 plus in those allocations. That should result in a little bit more for Nevada County. That is welcome. And we are ramping up our operations in accordance with that. We start off with small clinics, which we're doing primarily in our public health department, as well as in coordination with local providers, and then larger operations. So we're soft launching a clinic in partnership with Sierra Nevada Memorial Hospital this week, with more to come on that. We partnered with the schools to do a large-scale clinic to vaccinate teachers last week, and we're doing the same in the Tahoe Truckee area this week. And so we're doing larger operations now, bigger clinics, and using more of the healthcare system. And then eventually, as supply normalizes, the healthcare system itself will play a broader role in that in a similar way to how it does with the flu vaccine. In terms of who's eligible, this is another thing the state is considering changing, and we're expecting an update from them any day. But phase 1A was healthcare workers, and we've outreached to all the healthcare workers we could identify in the community. We've also got a form out there if you feel like your employer is a healthcare worker and you haven't been identified, then there's a form you can fill out on our website to let us know about that. But we've moved through phase 1A and we're now firmly into phase 1B, which is people 65 and older, and people in occupations that are high risk and congregate, such as teachers, emergency services, and food and agriculture. So the food and agriculture is still yet to be defined by the state. We're looking for further guidance on that, but we have started vaccinating teachers, emergency responders, and also people 65 plus. There's a lot of consternation in the community and in the state, because in Nevada County, there's 28,000 people or 29,000 people who are eligible based on the state's framework. But the state has clarified that it's more granular than that, that in a situation of scarcity, we prioritize people 75 and older and those sectors that I mentioned. And even for those groups, there's not enough vaccine to go around. And so instead of just putting it all out there for a free-for-all, we're really trying to target it to the people who need it the most by working with healthcare professionals or providers to reach out directly to their patients who they know are the most vulnerable. So people are getting calls and being scheduled in for vaccines in our community. So a little bit more about this. So here's where we currently are. As I mentioned, people 65 and older, and then those sectors are available right now in Tier 1 of Phase 1B. What the state has said is basically that it looks like Tier 2 of Phase 1B is going to go away completely, and they're going to move completely to an age-based framework. That will certainly simplify the work associated with administering the vaccines. It also will create particular problems for jurisdictions like ours, where a much higher proportion of the population is older. So as I mentioned, around 29% of Nevada County residents are over 65. Compare that to Placer at around 20%, Yuba County at only 13%. We have many more people to work through in Phase 1B than a lot of other counties. And as I said, our allocations are starting to recognize that, but we have but it's going to be some time before we get through everybody, just based on the scarcity of supply. And then the bottom on here, I just want to call out that the kind of grade area, people under 16 currently are not eligible to receive this vaccine. It has not been, there haven't been clinical trials that have proven its effectiveness or safety for people in that category. In terms of where will I get vaccine? So again, initially for Phase 1A, it was small targeted clinics working with a very prescribed people who are eligible. Now we've expanded to larger clinics and utilizing the healthcare system to a greater extent. As we get more supply, the healthcare system will become predominant, and we'll use targeted clinics to get to those that don't get it through the healthcare system. And eventually we'll have normalization. So right now we have a number of partners. They include our hospitals, both Sierra Nevada Memorial Hospital and Tahoe Forest Hospital. We have health clinics like our federally qualified health clinics and Chop-A-Day. We have pharmacies that have been onboarded. We have primary care physicians, and we have public health clinics. So people are getting vaccinated. Again, we're not throwing out 500 appointments to go to the people that can refresh their web browsers the most quickly. These are very targeted still until there's enough supply to do that. So moving on to how do I know when it's my turn? First of all, we're asking people not to call around to all the doctors and to public health right now. People are overwhelmed with calls, and there's just not vaccine enough to allow for appointments on a first come, first serve basis. So what we're asking people to do instead is register at myturn.ca.gov. We have now linked out to this on our website. It both allows you to be notified when you are eligible based on the information you enter, but it also will be used by us and our providers for clinic management, so that when there are appointments available, you can access them through here and be notified about them through MyTurn. So please go out and sign up for MyTurn. You can keep looking at our webpage where we're posting the most up-to-date information, and you can call 211 and they can help you find out how you fit in. And you can also register for text alerts from 211, where we post as we move through the phases and as we have more information by texting vaccine info to 898-211, or you can get those alerts by email if you call 211 and ask to be registered by email. We're also getting a lot of effort or offers to help. So the first thing you can do to help is be patient and realistic. We don't have enough vaccine to get to everybody who's eligible. We can't manufacture it ourselves, so we have to be realistic that it's going to take time before everybody who's eligible can get it. You can register to volunteer, whether you're a healthcare worker or not, through healthcarevolunteers.ca.gov. And that when we need volunteers to staff clinics and things like that, that's how you can, that's how we access people. you can donate to the Nevada County Relief Fund. As I mentioned at the beginning, we have a long road ahead. There's a light at the end of the tunnel, but with the new variants and with everything else, it can get pretty grim before we get there, and it's going to be a while before we have normalcy. And so there are still going to be businesses and providers who are in need of our support and help until we get there. And that's pretty much it. I think I've talked for quite long enough. Sorry about that.
No, that was terrific and really informative, Ryan. Thank you. Are there any questions? I'm seeing no open questions and looking over in the chat. I don't see any questions there either. All right, folks, usually you're not shy, but I think that speaks to how thorough the presentation was. So thank you, Ryan. And with that, why don't we transition over to the business resources update and start with Molly Legault, the Assistant County CEO.
Hi, good afternoon,
Molly,
everyone.
you got some news for us?
Thank you, Caleb. Good afternoon, everyone. I'll just be very brief and then leave plenty of time for Kristen and Leslie to talk about the programs and services that they have been highly engaged in. So just wanting to start out to remind everyone about utilizing the state and the county websites for information as well. We've updated our website recently. We've cleaned out a lot of the data or the information that had gotten old and stale. Things were changing so quickly and we were adding information. And so if you haven't looked at the county's website in a while, I encourage you to check it out and get acquainted with the resources that are available to businesses and individuals there, as well as there's a whole page on vaccines now and a lot of that information. Also, just as a reminder about our COVID-19 recovery email address, if you have questions about what does it mean to go from the stay-at-home order to the purple tier, or what would it look like if we made it into the red tier, please submit your questions. We're happy to talk through those with you and give you tailored answers and support based on your specific business. So please don't hesitate to reach out if you have any questions or concerns. Also, we are continuing to do outreach with businesses and just checking in. The county, we recently brought on Marnie Marshall, who some of you probably know from the Downtown Association in Grass Valley, to just help us be out in the field more and listening and being able to understand what are the needs of our business community. So if you haven't, Marnie hasn't stopped by and knocked on your door yet at your business. She is out. She's been just walking around Nevada City, Grass Valley, Penn Valley, up in North San Juan, just checking in with our business community to see if there's any ideas out there of the ways that the county can better support our business community. It's exciting to see some businesses being able to reopen a little bit more now that we're back in purple tier and out of the stay at home. Really seeing people utilizing outdoor dining when the weather has been good, being able to get haircuts and some of those personal services, which I certainly appreciate being able to get a haircut recently. So glad to see some of those changes happening and a little bit of normalization there, and really looking forward to when we can get back into the red tier and we can get another step closer to normalcy. So right now our data is not there. We're still squarely in purple, but I'm hoping that we can all continue to be vigilant and get ourselves back and our community back to a place where it's safer to be more open. And then finally, we have streamlined our process for citizens who want to express concerns about businesses that maybe aren't following the state guidance on being open. We're streamlining all of those through our Ask Nevada County app or button on our website. And then we're doing outreach to businesses to just remind them of where we're at, what's allowed, what's not allowed, and as well as passing that information on to the cities when those businesses are in the city limits, so that the cities are aware and they can also follow up with outreach. And that being said, complaints have dropped significantly from the beginning of January to the end of January. We had a big drop in complaints, and I think that's maybe related to being able to actually be a little bit more open with coming out of the stay-at-home order and also just the community adapting. So with that, also just I think everyone here is familiar as a reminder to utilize the Alliance for Workforce Development. If you have hiring needs, they just hosted a job fair online a week or two ago. And I know as we've been doing business outreach, some businesses really are struggling because they can't find people to hire. And so I strongly encourage you to lean on AFWD as support for your business if that's the situation that you're in. So those are the updates that I have for you today. I'm happy to monitor for any questions that come up, and I'll turn it over to Kristen and Leslie.
All right, thank you, Molly, and welcome, Kristen and Leslie from the Sierra Business Council.
Thank you, Caleb. We are going to, there's a lot going on. We're going to start with the most probably time sensitive, and that is the State of California Relief Grant. And before, which reopened yesterday and closes next Monday, the 8th. Don't miss that deadline. And it closes early in the day, like 6 p.m. So it's open now. If you applied already and you got a notification that you have been waitlisted, you do not need to reapply. A number of people are getting super confusing emails that say, everything's great, all your documents are in here, but maybe you should log back in and check. And here's the reason for that. 3% of the applications had issues with uploading. So most likely, if you are tech savvy, everything is fine on your application. You do not need to log back in. You do not need to check. If you're thinking, oh God, maybe I put my tax return where my ID was supposed to go and vice versa, go ahead and log back in. Another problem that we're hearing is people cannot access their password is not working. You actually have to call them, and I apologize. I'm going to put a number in the chat. Actually, maybe Leslie, you can type this in, 888-612-4370. That is the tech line that you can call and they can reset. You're going to wait, and we don't have anything to do with that. We're here to help understand and interpret that application. But it is open now. It closes on the 8th at 6 o'clock. So if you didn't hear anything, if you applied and didn't hear anything, you definitely need to log back in, because that means you got lost in the shuffle. Okay, who was awarded? We get this question all day long. They have not released how many awards came in our county, but I can tell you this, that all 58 counties in the state of California were awarded some amount of money. There were well over 300,000 applications. There were roughly 20,000 awards. So quick math, that's less than 6% of applications were approved. We know that 14% were rural, 58% went to low to moderate income. So that this weighted lottery system worked as intended. But if you're in a high earner category, the other category is 53% minority owned. So it really was weighted towards underserved businesses that missed out in some of the federal grants. So that is our update on the California Relief Grant. But it's the next round is another $237 million that's coming out to be awarded. So get your application in. You just never know, especially if you're a woman-owned or minority business. The latest federal stimulus, $908 billion in economic rescue. That second draw, PPP, is now open. Maximum revenue you can have on that is $2 million. Maximum employees is 300. And you have to show 25% reduction in gross receipts quarter over quarter. So what you'd want to do is take your best quarter from 2019 and your worst in 2020. Hopefully they're aligned, like third quarter to third quarter. And that's how you want to show it. They're super tight on that. If you can't show that, you are not eligible. If you're a penny over 2 million, you're not eligible. The reason is this round of PPP is really designed to the small businesses that could not get their applications in on time. The best contact for your PPP is either Leslie or I at your Small Business Development Center or your bank, and we can help you through that process. The EIDL loan, the Economic Injury Disaster Loan, is still open. It's a working capital loan for small businesses and nonprofits, and that is actually funded directly from the SBA Disaster Assistance Office. So still open. If you need help with that, or you want to know where to find that. COVID, actually, Leslie will put the link in because she's really good at that. I can see she's totally on top of that. Okay, I don't want to go into the targeted advance, but here's the thing. The new stimulus package basically made that. Some people had their $10,000 advance that at first it was a grant and then it got rolled into your PPP. That $10,000 does not need to be repaid now. If you have repaid that, you need to contact your bank so that you can get a refund. That will take time, but if it's rolled into your PPP, be patient. You do not have to pay that up to $10,000 back. Super confusing, we know, but that was pulled out in this round of stimulus package. Okay, another question we're getting a lot is the Shuttered Venue Operators Grant, another federal program that is super confusing. There is a webinar we have access to. We can post that link. This grant, unfortunately, does not allow venues that have flexible seating. It's only for fixed seating venues, which I don't remember. The last 2 concerts I went to were actually in Nevada County. One was at the Vets Hall and one was at the Miners Foundry, and there was no fixed seating. So there are a lot of venues that are not eligible for this. The other thing about this grant is that if you apply for it, you cannot apply for round 2 of the PPP. So you really want to think long and hard if you have fixed seating in your venue and you're eligible. Really look at the difference between how that's going to impact either your PPP opportunity or the shuttered venue. Shuttered venue is actually, you can't apply yet, but it's all the guidelines are out. Let's see. Major changes PPP, I talked about that. Loan amounts are based on 2.5 times your average monthly payroll. For the hospitality industry, it can be 3.5 times. The application has been extended to the end of March, so March 31st, 2021. This is coming through your bank. If your bank is not offering the PPP, there are lots of online lenders. Contact us. We have a list. We can help line you up with the right match for you. And let's see, talk about second draw. I think I'm going to pause. And before I have Leslie tell you what I forgot, I want to remind you about our free workshops. We have a lot of them on all different kinds of industries. Our counseling is also free, and we are still continuing our weekly Wednesday 10:30 a.m. webinar from our finance center, and it's all COVID-19 updates. It's a live Q&A, and your questions can get answered right away. So a lot of free resources for you out there. Leslie, what did I forget?
I don't think anything. There's so much going on.
Yeah.
And the majority is the deadlines for almost everything is March 31st. So stay tuned. There's going to be more California relief grants in the governor's executive budget. If that gets approved, there's going to be more COVID relief from the new party at White House. I mean, we're just expecting it's just ongoing and ongoing. The SBA.gov website is awesome. So if you go to funding programs, and it'll describe everything. So if anybody has not applied for an EIDL loan, just to repeat, the economic injury disaster loan, they've extended that deadline, the Office of Disaster Assistance, through December 31st, 2021. It's a loan, but call us and we'll talk you through it. It's the cheapest money you're going to find if you can't get a grant. And congratulations to Nevada County for the round 4 closure. That's awesome. So a lot of help in Nevada County locally. Obviously, I think we all know that one. That's local.
Yeah, and just a thing on that. The local grants were, we had for the Nevada County Relief Fund way more applications than money this time. But I think, correct me if I'm wrong, Caleb, we awarded 40%, something like that, somewhere around that. A lot better than 6%. So these local dollars are super impactful. And I just, I don't know if we'll do another round or what's going to happen, but, the donors were private, the county jumped in, the town of Truckee jumped in, and this is super impactful money when you look at, the cavalry is not coming from the state of California. So I think Leslie and I only know of 4 people that actually got that grant. maybe, is it 3 or 4? It's really hard to get from the state of California. And I wish we could do something about that, but the demand is so high, so high.
Yeah, no, it's just terrific that having this information about what's coming and for acknowledging too, yeah, the generosity of our community. For those who might not know exactly what we're talking about, the Nevada County Relief Fund just completed its 4th round on mid-January. So since our last meeting together, we raised $287,500 and allocated that to 73 small businesses and micro grants, and really great work by the Sierra Business Council on coming up with a really fair and equitable process for handling so many applications and so quickly. And that money has gotten out. We've gotten some nice thank yous and really messages like we thought. This $5,000 helps us pay the rent for another month, helps keep us going. And so thank you. And thank you for all of you who donated to that. We've raised over $1 million to date. About half of that came from Nevada County and Truckee and Nevada City, and about just under $500,000, and the other almost 600,000 was individual donations from you. So it's really speaks to the generosity of our community. Leslie, all of these programs that you just summarized, are those available, information available on your Sierra Business Council website or the SBDC website? How do people,
Both.
if they weren't taking notes quick enough, where do they get all that?
So all the federal programs are on the SBA.gov website and our website. And then the local products, the Nevada County, I'm assuming you put your pitch in for that, so everybody knows how to go to Nevada County Relief and find that on the website. And then the state programs, I think they're on our website, right, Kristen?
Yeah.
For the California Relief Grant.
Yeah, sierrasbdc.com info. The reason we put info at Sierra SBDC is that we can all check it. So if I'm wrapped up with something, Leslie can answer it. So we have now 4 people checking that info email so that you get a pretty quick response. That's the fastest way, unless I know a lot of you have my cell phone number. That's super fast too, but we'll get back to you as soon as we can and get you to the right application, information, support that you need.
Great. Well, we got some questions for you, Kristen. The first is from Gretchen Bond over at Miners Foundry. I thought the 10K grant was the EIDL, not the PPP.
It is the EIDL. However, if you also received a PPP, they rolled that 10,000 over as non-forgivable, essentially. It's super confusing. If you got both, that's what they did. They said, oh yeah, forget what we said about this being forgivable. We're now going to tack it on to your PPP and deduct it from what is forgivable. They basically changed the rules after they made the rules. So many people said that's completely unfair. So now they've gone back, but now you can see how there's a really messy paper trail on this. If you have a PPP and you haven't paid that $10,000, don't. If you've already paid it back, that's when you want to contact your bank. Yeah, it's just it's a mess. I hate to say it, but it's almost as messy as the state of California. Nevada County has their act together, people. They do.
It's a mess, but it's a really good thing. It's just going to take time to unwind it. So, like Kristen said, I wouldn't default on your loan with the bank. I would make the payments, but SBA is supposed to make the bank whole, who will in turn make you whole if you're an applicant.
Yeah.
That's helpful. So we have one more question. This is from Amber Manuel, Center for the Arts in Grass Valley. So she says that she's been researching the shuttered venue grant, and I'll just read it. We have been researching the fixed seating question, and many have already corrected that it was a mistake in the guidelines intended for movie theaters only. Have you not heard about that error? We're talking to the SBA about it now, but don't have 100% confirmation.
So as of Monday, they still had no fixed seating, and they were very firm about that. And Joe, I've been actually thinking about you specifically on that, and Gretchen. I know Gretchen dug deeper too, because and the fairgrounds also is curious about this. So as soon as we find something different, I hope it was a mistake. I mean, it takes out so many venues. I hope it was a mistake. I can't, and we'll continue to press on that. We went to our state office and said, this doesn't make sense. In fact, yeah, our state office started listing off the venues they've been to that don't have fixed seating, that are clearly have been closed. So.
And it's a federal program. So we do have to remember that it's not just something you pick up your phone and you talk to your legislator about. It comes from the Treasury Department and the U.S. Small Business Administration. So it's not an easy fix, a quick fix.
Right. We have a great district office. They're super responsive, but there's only so much they can do.
Not at the district level, it would be at the administration level and the Treasury Department.
Yeah. A lot of,
Yeah.
so many venues having a problem with this.
When it's crazy to penalize a venue for being flexible and being able to accommodate different types. I mean, that's like, you might as well just say movie theaters and sports arenas. So
You know what?
thank you for being on that. And thank you, Amber and Gretchen, for knowing, being good advocates out there and sharing that information.
I think it's an indication that no one who works at the Treasury actually goes to concerts anymore, because otherwise they'd know. The people making the rules would know. That's the way it is.
Yeah, we all want to get, those of us who, like our live music are eager to get back in front of the stage.
Yes.
All right. Anything else, Kristen and Leslie, you want to share with the group?
Yeah, and don't, if you're
Right.
struggling over a website, just give us a call. We probably can fast track you to the right answer or the right person if we don't know. So.
I think my last comment would be apply for everything.
Yeah.
Nobody wants to go into debt. You cannot accept a loan, but apply for everything. And then you could say, no, thank you, as opposed to look how long we've been in this. And people said, oh my God, I should have done this a long time ago. So apply for everything and just see where you sit at that time. And maybe we could help you through that.
Yeah.
But some of the loans are very, very low interest rate.
Yeah, or maybe they're emergency money and you dip into it, briefly, and then there are no early payoff penalties on any of these. So.
Great. Well, any final remarks or points, Molly, Ryan? Nope. Okay. And then just for the attendees, thank you for participating. If there are special topics that you would like to see addressed in these monthly calls or information, don't hesitate to reach out to me and or to SBC. Let us know what information you need and what you need from these calls. Whether it's public health information for your business, for your employees, we really want this forum to be useful to you. And just remind you that we are meeting on the first Wednesdays of the month. So our next meeting is March 3rd. And I think I will close by turning it back to Supervisor Schofield.
Well, thank you, Caleb. And I wanted to thank you and Ryan and Molly putting this together and the information. And I want to give really a special thanks to Kristen and Leslie. I know how important that part of is to our business community. I know how complicated it can be, and to have somebody you can actually contact and help them walk through these issues is really wonderful. So thank you, thank you, thank you. And while we are meeting monthly, I would venture to guess, with things changing as quickly as they can, whether it be on the vaccination level or on the business level with what's coming down from the federal government, we could make this a more often meetings. So kind of stay tuned. And as Caleb said, if you have any suggestions as to what you might want to hear, please let us know. I found this session today really pretty rewarding, really. So thank you to everybody that participated. Thanks, Caleb.
All right. Yeah, thank you, sir. And just a reminder to all of you, the assumption is that you are representing and well connected into the community, and that you will forward our emails and links to your constituents, let them know. I'm always happy to add names to this mailing list as well, but we're really counting on you to look at the agenda and think, yeah, my members need to know this, and with the webinar format, it makes it really easy to just let as many members of the public participate as would like to. So with that, I'll thank you all and take care, be safe. And thank you panelists for another great presentation.